Health Science Center. She has practiced as a gerontological clinical nurse specialist in St. Louis and San Antonio and has taught both undergraduate and graduate nursing programs. She's also actively involved in Alzheimer's Association, and her research interests include holistic assessment and management of chronic pain in the older adult. And she's got a pretty unique presentation for you today. We're going to talk about some alternative types of medicine, a little bit different subject than what we've had, so I think you'll find it very interesting. So please welcome Dr. Ruzicka.
Well, good afternoon to y'all. I felt honored to be invited. I do have a clarification on the introduction. I finished my 2-year research fellowship with the GREC at the end of November. So right now I am at the Health Science Center School of Nursing. But I enjoyed the fellowship. I learned a lot. There's nurses out there in geriatrics or palliative care. I highly recommend it. I believe Denise Minor-Williams is presently doing a fellowship. And if you have questions about that, see either of us, that'd be good. When I was asked to do this presentation, they initially gave me a few topics, and we talked about problem behaviors, talked about ethical issues, and pain management. But in talking with Natalie, she said some of these are going to be talked about in the next 3 days. So we started talking and thought, what would be of interest, and what may be a good afternoon topic, and something that won't be talked about probably elsewhere in this next 3 days. And so that's how we came upon the integrative care. Now, how many people in this room are familiar with complementary and alternative care? Can I just see a show of hands? Okay, and in what way are you familiar with that? And how many of you have used some form of complementary or alternative therapy? Can I speak? For self, for others. Okay. So we've got about 5 hands out of, what, about 25? So that's a fair percentage. If you look, today what we're going to discuss is, how do I advance this?
Push the right clicker.
This one? Just press that?
Yes.
Okay. Or if there's another way I can advance it, I can do that.
Try it again.
Try it again. Okay. Well, it's an interesting slide, but I don't really have to have you guys look at it all day. So.
We switch computers after the last speaker. Just a couple seconds.
Okay.
If not, I'll do it.
Okay. I think we get to do the manual.
It is true.
Is it magical? Okay. So in the next 45 minutes, what I'd like to cover with you is just really identifying the different terms that are used in CAM so that you're really familiar with it. And then when your clients come to you, or your clients' families come to you, that you're well versed in what they're asking about or what they've heard about. I think that's an important piece in our practice. To appropriately differentiate between the different modalities, because there are differences. Discuss how CAM is being used in the United States and to what extent. And to discern the importance for us in our profession, whatever it may be, that we really facilitate our patients, because sometimes there can be harm incurred, sometimes there can be a lot of doubt and a lot of unknowns. And our job is to really, I believe our job, or my job as a nurse, one of the things I love doing is to facilitate a person so after they've been with me, they feel more secure, they feel better armed, they have better access to resources, and hopefully they're more comfortable. Okay? So that's basically our outline. Complementary medicine has been used for many years. I think that this term is an older term, and it's thought of as treatments that are used in addition to what is being offered. Can anybody think of a complementary modality? that they may have used or you may have suggested to a patient? Biofeedback, okay? That's a good example. Okay, aromatherapy using lavender. And you would use that in conjunction with regular, more standardized Western treatments, okay, to facilitate. The biofeedback, what would it facilitate? Okay. So anecdotally, you've been able to use it and you saw good results with it. Okay, excellent. And you can use, biofeedback is used a lot for relaxation. I've seen people use it before testing, and it's been a facilitator. I've seen them use them with pain management very effectively. With anxiety in general, it's been very helpful. With the lavender, what's the benefit of that? Relaxation. And in fact, I was up in St. Louis at a couple of weeks ago, and in the hotel, now they have a packet, and in the packet was a little lavender spray and a CD to help you relax before you go to bed, and have tips for better sleep. And I thought, wow, we've really come a long way, you know. So I took the lavender home with me, because I like it. It was a good. Alternative medicine is typically thought of being used instead of conventional methods. So does that make sense? The complementary term is used when you use it in complement with an existing Western medicine. Alternative is where somebody would choose to use that instead of the standard Western medicine treatment. So can anybody think of an example that we often hear of people using alternative methods? Pardon? So, okay, like, so if somebody has hypertension, rather than using a standard medicine, they choose to use garlic, right? Garlic or omega, right? Okay. And has anybody ever heard of somebody being diagnosed with cancer and abandoning chemo, radiation treatments to try maybe like some type of herbal remedy? Okay, that would be an example of that as well. Okay, now if they were using it in conjunction with the chemo or the radiation, then that would be complementary. So does that make sense to everybody? Integrative medicine is a term that's really come up in the past few years. Originally, a lot like Harvard, they've had a complementary and alternative section of healthcare for 25 years. Now, Duke is younger, they have an integrative healthcare. Harvard now has an integrative healthcare. So the integrative term came into being after the complementary and alternative. And that really is the term that if you're looking in the literature and you're looking in research, that you're really going to see more often. Okay? And with this, you combine the complementary treatments with conventional care, and that's the way it's actually introduced. So when you go to an integrative center, they would introduce the standard Western treatments as well as maybe more of the complementary modalities that we've been speaking of. Okay? In the center of this, I don't know if you can see it, in the center of this image over here, which came out from the Duke Integrative Center, is mindfulness. And mindfulness is a term that came out of the Buddhist philosophy. But it's seen in many cultures, it's seen in many religions, and you can also term it as being present, being aware, being fully alive, being connected, body, spirit, mind. And so it really talks about that. And then I don't know if on your handout you can see these terms, but this is the mind-body connection, movement and exercise, nutrition, physical environment, relationships, and personal growth and spirituality. And all of these are incorporated if you're doing a good integrative practice. And do you see a benefit with that, anybody? in taking care of patients, if you include all of this, what are some of the benefits?
Doesn't the patient become more responsible or have more of a sense of control and self-responsibility?
Ownership is very important, and mindfulness brings one into more ownership. That's a very good point. When we go in and we assess our clients, do we typically try to look at all these areas? That's an honest answer, no. Would we like to? Absolutely. Do you see how the extra 10 minutes in at least touching base on these would formulate perhaps a different plan of care or bring into fruition a different outcome for the individual? Does that make sense to everyone? Okay. So how many of you have been ever rushed on your job? I have, and you may have a caseload that is overbearing. So instead of being at the highest standard where you're imparting, the most wonderful care in the world, you've had to drop your expectations to delivering safe care, right? And that's a challenge for everybody in the health field. And if we can take those extra 5-10 minutes and really try to assess these different areas and incorporate that into the modality of care that we're offering, it really does benefit both us and the client and the client's family. We use a lot less leg, running back and forth. If you don't assess well, you're running back and forth down the hall, and these days you're emailing 15 times instead of 3 times. So sometimes if we slow ourselves down a little, make sure we address all these issues, then when we do incorporate the plan of care, stuff pops up that's really more helpful for us and helpful for the family. Also, the family feels listened to. Has anybody ever been in a hospital or in a situation where they've had to be on the receiving end of healthcare? In that experience, did you ever feel perhaps less than or not heard? Okay. And how important that really is. If we're really going to deliver good health care, one of the first things we do is establish trust. And if you're not felt like you've been heard, it erodes that trust right at the beginning. So a couple extra minutes in this modality really, or in this assessment really is beneficial. So the basic principles that we use in integrative medicine or healthcare is we're focusing on wellness. So, and a lot of times in the hospital situations or in the clinic situations, you may be focused more on disease management. I don't know if you've seen that. Yes or no? Yes? Okay. And with the integrative healthcare, the approach is really more focused on prevention. And with the mindset that the body really is geared to heal itself and wants to heal itself. So how we approach it, if we've got the integrative mindset, is that we would really assume that the body is capable of healing itself if we give it what it needs. Does that make sense to everybody? Okay. The practitioner then really dethrones himself or herself. We're no longer God directing the care. We're facilitating the care, listening to the body, listening to the person, and then trying to facilitate their health. Does that make sense to everybody? Would everybody like this every day of their life? This is what healthcare is really intended to be, and quite often you see very good practitioners just inherently practicing it. I think that's why we all went into healthcare. It involves a very holistic approach. I think we've talked about that. Statistics on CAM use in the United States: 36% age 18 and over have used some form of CAM. 62% have used some form of CAM, which includes prayer. So that's a big piece. Another interest of mine is the spirituality in healthcare and how that's a piece that holistically we need to look at. So when I was preparing this and I saw 62%, I thought, wow, that's huge. And that is an important factor. Does it mean that we would go out and we would pray over people every time we do an interaction with them? Or before they go a procedure. Would that be appropriate? Pardon? Exactly, not unless they want to. And that's really important to respect the boundaries. And so in the assessment, we're going to assess that aspect and assess those boundaries on what's appropriate and what's not appropriate. Okay. This came from a CDC data report. It's dated 2002. So the current statistics may be a little bit higher than back then. But this is the most recent data that the CDC has published, and that was in 2004. The incidence and statistics, this is just a sample for you to see. 43% pray for their own health. Has anybody in here, can I see a show of hands, how many people have prayed for their health in their life? Okay, well I'm looking at 100% of hands raised, okay? How many have prayed for another person? Okay. How many have really tried to use some herbal or botanical, natural supplement in their life? Okay, so about half of you, okay? And that, we've got 20% statistically. One thing that was interesting is I was talking with a woman who works in DC at a very nice, at the NIH area. And the results from a lot of the research they said had really changed a lot of the nursing's practice. So a lot of the nurses on the floor were actually taking a lot of the supplements and stuff that through the testing they had found had been really beneficial from a health perspective. So I think the more we know about it, the more we actually want to use it, so that the healthier we are, the better we can serve others as well. Deep breathing exercises, statistically about 12% of the population use this. And this is data from 2002 that was published in 2004. That has become a very common practice that I've seen among the lay population. And I've heard it like on radio shows and in unlikely arenas. I have a 8-year-old and she's watching some Disney show and in the middle of it, they had the kid slow down and breathe. And they did it exactly like Dr. Benson taught it, 20 years ago, where they breathed into the count of 4, held it for the count of 4, and breathed out. So it's into the mainstream if it's on the Disney Channel and it's being presented to, young kids. So I thought that was interesting. Participation in prayer groups, about 10% of the population doing that for their own health with that intent. Meditation is 8%. Chiropractic care is 8%. Yoga is 5%. Has anybody tried yoga in this room? It's hard, isn't it? I mean, so it kind of threw me. But it's very good. And in fact, I was reading an article the other day about as far as exercises for injuries, like with marathoners and runners. The statistics show that stretching doesn't help if you do it before running. It helps minimally if you do it after. But if you participate in a stretching program 3 times a week or more on a routine basis, that it significantly reduces. That population has about 80% less strains. And I thought that was pretty impressive data. The massage is about 5%, and the diet-based therapies are about 4%. Okay. So this is what the population you're serving is seeing. Okay. The incidence and statistics, why do people use CAM? Okay. 55% believe that it helps them when combined with conventional treatments. 50% just think it's interesting. Has anybody tried CAM just because they were curious about it? So a lot of your clients that come to you may be asking out of curiosity. So the responsibility of the healthcare practitioner is to really be grounded in the research. And what does the research say about what they're just thinking about doing? I've had patients come up and ask about St. John's wort. Statistically, it's not shown to make much of a difference. But if they have 3 friends who've tried it and it has helped, and then you need to educate yourself, look at it in combination with other drugs, so that when people come to us with those questions, we can from a grounded research base, give them appropriate answers. What else? 26%, so almost a third of the individuals are saying that a professional actually has suggested that they try CAM. I think that will increase the statistic as the evidence grows. Conventional medicine was too expensive, and that they felt that conventional medical treatments would not help them with their health problem. So then they sought other avenues. This is a bit blurry modalities chart, but it shows you all that's out there. There's a lot of stuff out there. So it helps us to know the terminology. So when somebody's talking about Native American healings versus Chinese medicine versus, spiritual health, that we're familiar with all these terminologies. So I wanted to include this wheel in to show you what the different modalities are available to our clients that we're serving. And one may fit the person better than another. There's no right or wrong here. It's just what's the best fit for the individual with the situation they have. Yeah. Anybody else have a comment? All right. Some of the terms I wanted to just review with you, you may already know, is our Ayurveda. This form of medicine originated in India more than 5,000 years ago. Emphasizes unique cure per individual circumstances. So the treatments that they really encourage is yoga, meditation, different massages, different specific diets, or herbal treatments. And they're specific to the individual, pertaining to what the individual is seeking. Homeopathy, this is where you use minute doses of a substance that causes a symptom which will trigger your body's self-healing response. So really, it's just like a jump start. It's like, has anybody ever needed a battery charge? This would just be the cable to get your body started and get it back in routine. Yes, you have to. Well, you need to look at the person holistically, because if you just give somebody something without looking at what else is going on in the person's life, or what else the person is taking or ingesting, or common practices that they may not see as medicinal, but is, it can have bad effects.
In principle, how is that different from, say, vaccine? Some of our vaccines, is it kind of a similar principle?
Well, I think the vaccines do stimulate, but it's the methodology that is quite different with vaccines. Because the vaccines take a dead virus. But I see what you're saying. This, from what I know, the homeopathic, like if you take magnesium, it shouldn't cause, you don't need wolf flush out. But you have to look at the other medications that the patient's on. And it may be contraindicated for that patient. Okay? Where the vaccinations, I think we've got some statistical data accumulating on some of, I think the latest thing they're really looking at are the incidence of autism that's resulting from it. So that's actually causing a malady, which typically you don't see in the homeopathic remedies. But you have to be careful with what is going on with the patient. So you just don't recommend, oh yeah, this is good for you, take 3 of them a day. You have to stop and look and discern what fits.
This is a little off topic, but since you mentioned it, I'm just curious what you think. Don't they attribute that autism to the thimerosal more than the dead virus?
Yeah, well, we can talk about that later because it is a bit off topic. But no, but it is interesting, and I'm glad that you're attuned to what the specifics are in it, so when people ask you, you can educate them on that. Naturopathy is when you focus on the non-invasive treatments to help your body do its own healing better. So these are modalities such as massage, acupressure, acupuncture, herbal remedies, exercise, and lifestyle counseling. Does that make sense, the difference on that? These are non-invasive, basically. And, just an aside, there's been a lot of, there's a clinic for palliative care up in St. Louis associated with Washington University. And the research that they're finding with just acupressure for smoking cessation has been extremely beneficial. Statistically amazing. And they're getting ready to publish on that. So there's these modalities really can complement a healthier lifestyle and facilitate the person getting to where they really want to be in life. Okay. Ancient medicines, these include Chinese, Asian, Pacific Islander, American Indian, and Tibetan practices that have been passed on for generations. Mind-body techniques, those include meditation, yoga, biofeedback, prayer, hypnosis, and relaxation and art therapies like poetry, music, and dance. And that makes sense how through these modalities the person would integrate the different aspects of themselves a little bit better. Does that make sense to everybody? Has anybody ever tried any of this in this modality? No one? Has anybody ever colored with a little kid and felt better for doing it? Yeah. Okay. Any comments on that? Dietary supplementation and herbal remedies. These treatments use ingredients that are found in nature. There's a lot of controversy with the use and abuse of this, and I think Europe has standardized this form of intervention, and the United States is now looking at standardizing the supplementation. So we may see this being delivered in a more uniform delivery mechanism in the United States probably within the next 10 years. Dietary supplements and herbal remedies. These are treatments that use ingredients also found in nature, but we have to be careful that, if you dealt with patients who are like, well, it's natural, so it must be okay. And so as health practitioners, we really have to come in and say, wait a minute, too much of a good thing can be bad, or it may not fit with what you're seeking. So that's where we need we need to be educated ourselves, and we need to be able to resource these people well, okay, and ourselves. There's a lot of side effects they need to be aware of, and they always need, I really stress this, talk to your doctor before taking the herb or supplement. Some individuals may not even see it as a medicine. It may just be a practice that their grandma did, and they just do. So when we're interviewing a client and assessing a client, rather than saying, are you taking any medications or supplements, we may actually get more information back that is helpful to us and our client. If we ask, like, are there practices that make you feel better when your stomach hurts? Is there something in particular you do to make it feel better? Do you see how that's a more wide open answer or question? So it'll bring in more varied answers that are helpful for us guiding your care. Manipulation and touch. This is mainly massage, chiropractic, and some touch therapies such as osteopathy, craniosacral therapy, and acupressure. And I mentioned the acupressure. They do it specifically on the ear. There's some physicians that are trained in Eastern medicine that their whole practice just involves treating the client through the ear. And it's just using different pressure points on the ear, and they feel that symbolizes, or that's connected to the whole body. So I do not know a lot about that practice, but I've been made aware there's a couple of people in San Antonio that specifically use practice on the ear. Energy therapies are another modality, and this is the assumption that the invisible energy force flows through each of our bodies. And that when this energy flow is blocked, that energy becomes congested, and then you're unbalanced. And so that's when you get sick. So these therapies, the goal is to rebalance your energy or rebalance your whole body by unblocking certain parts of your body that are blocking the energy. Has anybody heard the term chi? Chi is okay, can you talk to that? Okay. Okay. Yeah, now she mentioned the term chakras. Are you familiar with that? If somebody comes in and tells you, my chakra's off, or this one's closed down, or I'm going counter instead of, I'm not able to receive, those are all terms that they'll use with the different chakras. And what they're talking about are different points of the energy input and expression from what I understand. And if these are turned off or blocked or not connected, and I think there's different points in your body that are all connected. So somebody doing the energy therapies would seek to connect these and let your chi, which is the main energy, flow more freely. And then with that, the person would be on the healing track and be more integrated. So those are some terminologies that you may hear about. And if somebody comes in and talks to you, if you can at least recognize that, that increases that level of trust that you have with the client. Okay? If you look at them and laugh, it's probably not going to do a lot for the, for my situation, the nurse-client therapeutic relationship. So in these energy therapies, and there's actually been, I read a study recently done through the VA in Galveston that they looked at individuals with Alzheimer's, and they looked at agitated behaviors. And by just using the energy modality of healing touch, which is the American Nurses Association's approved modality for the energy work, they found a significant reduction in aggressive and resistive behaviors through application of this energy modality. It was a small study, and I think it would have to be replicated before you would put it into an evidence-based practice recommendation. Other therapies include therapeutic touch, which I just talked about, Reiki, magnet therapy. I was talking with a lady that is an internal medicine board-certified physician about 2 weeks ago, and she has a practice where she does she works with people in the hyperbaric wound healing area, and she's been trying just not from a research base, but just anecdotally putting magnets and using the magnet therapy, and she's found anecdotally a really good response rate with the capillary refill in areas that have been ischemic while she's doing her wound healing treatments. So I thought that was interesting, and I think there's some research out there with the magnet therapy. Light therapy, polarity therapy. Light therapy has been shown in the research to be very helpful with depression. And by using different modalities of light therapy, it's diminished the degree of depression that an individual is experiencing.
Would that also include electric medicine or using electricity to, just kind of redirect
Oh, like TENS? Like sometimes we'll use it.
TENS, I think it's more for pain relief, of course, it's also very effective for that. But I've also read some research by Dr. Robert Beck about using electric therapy for directing viruses and bacteria and parasites, and all that sort of thing.
Okay, that's interesting.
Yeah, I thought it would fit in, it would probably fit in with
I don't know if it would fit in energy work or I don't know. I'm not exactly sure where, but it definitely would fit in integrative modalities.
They always talk about it in conjunction with magnet therapy.
With magnet
That's
therapy.
what I was curious.
Okay, well, that's good. A premise in a lot of the integrative therapies is that we are just one big electrical system. If you look at, when we take an EKG, what are we looking at? We're looking at the electrical conduction of the heart. So research, there's a division that's called the National Center for Complementary and Alternative Medicine. And their mission is to really explore this area, to look at the healing practices that are being done and look at them in context of research so that we can either recommend it or we can fine tune it or we could say, no, this would be harmful in these situations. So the whole intent is to educate us in these healing practices if they're helpful or not. It's also to train researchers in this area and, of course, to disseminate resources to the public. I included in your handout a lot of resources. I think the biggest thing that, one of the biggest things as health practitioners is to keep ourselves continually abreast of what the current data is. So that's why I left a lot of the sites for you to click into and get familiar with. Research priorities that they have right now are anxiety and depression, cardiovascular disease, ethnomedicine, immune modulation, inflammatory bowel disease, insomnia, liver issues. And a lot of the liver issues they're finding are, well, number one is alcohol, but another etiology for the liver dysfunction is side effects of the current medications that are being prescribed for sundry of disease conditions. Okay, so they're wanting to look at that. Obesity and metabolic syndrome. Our children are at a in a horrible situation in our society. It's the first time that our kids are actually projected to have worse quality of life than their parents. And we're a highly educated, highly indulged society, and yet this is a rising problem. So they're looking at some of the other alternatives for dealing with some of these issues. And the respiratory diseases are on the rise. And they found when they look at it, I think in the past it said it was related to our industrialization and it was related to our the pollution. But the research isn't validating that. New Zealand has one of the best air quality areas in the world, and yet their asthma is increasing at the same rate as we are here in the United States. So they're looking at other etiologies and other ways of treating it. Has anybody been to H-E-B lately? Can I see a show of hands? Anybody go grocery shopping? And when you go grocery shopping and you go down the aisles, anybody seen, like, for insomnia, all the stuff for pain management, all the stuff is becoming prolific for anxiety. There's a lot of over-the-counter stuff for these areas that they're addressing here, and it seems like it's just getting larger and larger. But statistically, these issues are getting larger and larger and more common in our society. So we're looking at alternative, different ways of helping manage this. Websites for the research. There's a nice website for current studies that I'd really recommend all practitioners to kind of tune into so that they just know what's going on. I know with the Alzheimer's Association, the Harvard University is in their second phase of looking at training the care providers, the informal care providers, with energy therapies and energy modalities to facilitate calming themselves down as well as treating their loved one that has Alzheimer's disease. And the first phase looked well, so they're going to the second phase now. So I think it's kind of interesting to tap in and look at what they're doing. Other sites that are good is the University of Maryland program, University of California, San Francisco has done quite a bit of extensive research. Duke Integrative Medicine, Harvard Integrative Medicine. And I give you those resources because I think it's very important when you're talking with your patients and they come in and they say, oh, you know, this magnet therapy, I called this 1-800 number and got this 8-pack of magnets and it's going to change my life. And so you need to be able to sit down and say, okay, where's the source? Where's the site? Who's guiding this? Who's behind all this? To look at the big picture. Much like when you read a study saying that a specific medication is fabulous, you have to look and see who funded that study And if it was the, pharmaceutical agency that has this medication, you need to discern with that. And part of our role as health practitioners is to get educated ourselves, but also to educate the individuals that are coming in, so that there isn't a lot of fraud and a lot of abuse of our clients. We want to facilitate them and well arm them. But yes, these are approaches that may be very helpful, but enter it picking good websites to go to, be well educated. And then as practitioners, we don't want to go around saying, well, I tried it when my back hurt and it really helped, so it'll help you. That's not going to be really helpful. If you have it with backed research, 80% of the individuals doing this, in addition to whatever therapy they're doing, have found that it's beneficial. Then that helps the client in a really healthy way. Does that make sense? And how important that is to help start guiding the client into how to look at all this stuff. Because there's a lot of stuff out there. Do you guys remember like the grapefruit diet? How everybody was going to have a great blood pressure and no cholesterol issues and lose 85 pounds in 3 weeks, And there will be people that will gravitate to that. So you need to really sit with them and clarify what's helpful and what's not. Okay. An example of how we use this in our practice on a day-to-day, I just had a couple examples. The first one was the acupuncture. And the research on this is pretty good. The research shows that it's cost-effective and it's helpful. 56 male patients with chronic low back pain, 62% that received acupuncture returned to their jobs, and they were able to go back in and serve society and go back into a pre-existing role that they had. So on a holistic perspective, that's what we want to do. We want to facilitate these guys back into the mainstream and make them feel, that increases self-esteem, it increases productivity, it helps the revenue of the United States government, it helps everything. Compare that to 15% of the patients who use standard care. That's a pretty large statistic. So the evidence-based recommendation would be to strongly recommend that when it's available, use acupuncture or electroacupuncture treatment with caring for people with this low chronic back pain. This comes from the guidelines from the government. I left the website. And I think that's a really good resource for you guys to use in your practice. Another example is omega-3. We've heard a lot of things, how good it is, and actually at the last cardiovascular conference for physicians, I was talking with an internal medicine cardiologist, and he was saying that they're coming out showing that the omega-3s are really helping in multiple ways that they never dreamed of. So the benefits from the omega-3s are abundant. Research has shown that it decreases arrhythmias, triglycerides, decreased growth rate of atherosclerotic plaque, and slightly lowers the blood pressure. So the evidence-based recommendation on this would be to really encourage people to increase eating fish a couple of times a week. Now, would you tell them to eat tuna fish? Or what would you do? You have to look at that. You're not going to tell them to eat the little, remember those little fish sticks that you get from the cafeteria when you're in grade school? Those are not going to be helping them. But salmon has been proved to help. Mackerel has been beneficial. Halibut is beneficial. So as you get educated, give them examples that they can use. And when we do that holistic assessment in the beginning, if they hate fish, you don't want to go there. They'd be taking supplementation, right? And if you incorporate that in your conversation with them, that you remember that stuff and say, I know you don't like fish. I know the omega-3s are really good. This is how you can do it. Then that increases the trust level. That increases the fact that they are significant. You are listening to them at all levels, and you really are there to facilitate them in their lifestyle. Oftentimes I hear everybody gets burnt out, and it's like, we tell them stuff, but they just go out and do the same thing. Well, there is free will, and that is an issue, and we have to respect that. But then there's also different modalities in the way we communicate what we know. And if we can somehow get into their mindfulness, to their awareness, into their world on what works, then we can hopefully incorporate some of these evidence-based recommendations tailored to their needs and what will work with their lifestyle. Okay? So in summary, integrative healthcare is here. It is being practiced. It is being demanded by our clients. Each generation, I think they're saying each decade of us on the aging trajectory increases demand expectations. Has anybody seen that anecdotally? That people demand, and they're coming in, citing sources and demanding, are you doing this here? You're typically seeing that more often. And it's only going to grow. So it behooves us to really be aware of these practices and to be aware of the research that's looking at these different practices, what works, what doesn't work, to make a difference. Our clients are seeking better ways of healthcare with fewer ill effects. That's been a real big issue. I know there's been some preliminary research saying that the statins that everybody's taken to reduce the cholesterol levels is taking a huge toll on our cognitive abilities. So they're seeing some cognitive deficits with that and some preliminary studies with long-term use of that. And that's a concern. So if a patient comes in and tells you this, you want to be kind of prepared on finding out what their resources were and listening to that. And then looking at, okay, so what are some alternatives that we want to try? Okay. Our service to them is to be informed, to guide them on their journey, remembering it's their journey, not our journey, and to really try to enjoy it with them. That it's so that as we go into aging, it's not a fearful framework, but rather it's kind of a nice adventure. You all have seen from time to time somebody celebrating their 100th birthday, that it's just absolutely lively and full of life. And I think by incorporating some of these practices, by doing holistic assessment and intervention, that we can really afford our aging population better odds of doing this. And these practices don't start when they hit 65. They start when they're 20. They start by us role modeling. They start by people that may just have borderline blood pressure. That's the time to get them, you know. And it's those teaching moments when something really captures them, that's the teaching moment to make a difference. And that's where our assessment and just being with them a little and our mindfulness and caring for them ups the odds of being able to tap into those teaching moments and make a real big difference. Are there any questions or comments?
If you have clients come in and they demand their herbs, for instance.
They demand their herbs?
Yeah, when they come to the hospital and they're taking something on a regular basis, and usually the doctor, as long as we kind of check it out, will comply with that. But they'll, you try to talk about it. You said, for instance, we need to be careful about the side effects and unknown effects. Well, they'll come back and they'll say things like, well, look at all the allopathic medications that have lots of bad side effects. So you can't, they're telling us you can't really say that to me because we've got
No, you can agree. Actually, you can. What I do is I agree with them. They're all on meds. There's a lot of meds out there that have bad interactions.
And some of them are being taken off the market.
Right. So actually you applaud them for knowing that, and you agree with them, and you tell them that is absolutely true, and it also applies in these natural methodologies as well. And we found that if you take this in conjunction with this, it increases your bleeding. If you're on, cumin, you have to be really careful of how much spinach you take in because it will throw off your levels. So what you need to do is you celebrate that they're actually being mindful and taking charge of themselves and wanting certain things, and you capture that, and that's a great teaching moment. To say you are absolutely correct, and that's why we're doing this, and that's why I'm cautious, and I want you to know, and that's great. Apply that to you, because the more mindful you are of what you're ingesting and how that's all interacting in your body, ups the odds that you're going to age well. So make it a victory. Does that make sense?
And they also say things like, well, most medications are derived from higher concentrations of these same herbals, like
Which is true.
valerian. They derive what is it that they get from valerian? Valium. Yeah, the Valium is derived from valerian root, and the St. John's wort.
Well, digoxin is derived from. If you look at the majority of our medicines, where did it all start from?
Plant-based.
Yeah, that's an excellent point. And tell them, yes, absolutely. And that's why the research is needed, so that when we make our evidence-based recommendations, that we're saying. So, and I think it's really important to watch the words we use with our clients. In dealing with our clients, if we can get in the same page with them, because the reality is we are on the same page with them. That increases our trust level. It enhances our practice. The only reason we're really here and getting paid for what we do is to serve them, right? And we are part of them. When we're sick or when we're in need of guidance, we go right into that. And so if we can get into the communication of us together working for a goal, and right now at this moment the particular goal is for you to blah blah blah, whatever the goal is. And to be clear that their goal, what it is, because preventing disease, saying if somebody's goal is that they don't get on blood pressure medication, that's a very different goal than saying I want to be aerobically fit, or I want to be able to run a marathon, so to help them maybe step into a positively stated goal, pops them out of the fear base into more mindfulness right away. Do you understand that? Because the fear thing is like, well, I don't want to be on 25 meds and not having a life. That's a fear-based response, and as a practitioner, you would listen to that and then try to communicate it in a not fear but a more mindful-based response. Does that make sense? Question or comment?
No, a question. It doesn't relate so much to the elderly per se, but let's say you have a newly diabetic person, and before you discharge them, they ask you questions, and this is asking you if you know of any holistic medicine out there for diabetes. Now you may know, but you want to tell them, yeah, there's a lot of things out there. You may want to explore them, or you may want to just find out about it through your neighbors, or do you just don't say anything?
Oh no, I think you need to answer the question honestly. I think you need to also say who's directing your care. And to really, the communication piece is paramount. I was talking with a...
You always discharge them with all these instructions and follow up with the doctor, and there's always follow up with the doctor.
Right.
But there's also all these other things that people are doing that in the neighborhood.
Right.
You may know, but I'm like, you really don't know this person enough to say, oh yeah, some people are drinking the cactus juices, and they say it works. Some people are taking these other plants.
Yeah, and what you can tell them is, yes, that is going on. Applaud them for questioning different resources that they can use in managing their diabetes. It's epidemic in South Texas, and so if we can create different modalities, we can say, the research isn't in on cactus juice, but I have heard that. But before I would get into that, I would feel more comfortable that's research-based. They have found that by increasing your activity, like just walking, it doesn't have to be a marathon, it doesn't have to be anything major, but by just changing one little thing in the next 2 weeks, can you walk, around the block, or is there a facility near if you feel more comfortable to And can you look at less refined food products? You know, instead of eating the white bread, eat a bagel and for breakfast because it's got a longer, it has a lower glycemic index. Or if you're going to pick a fruit, don't eat watermelon because you spike up and you spike down on the sugar. But if you eat an apple, it sustains you longer. So teaching those, so I actually say that's a great comment. Yes, there are ways you can manage it without the medicine, but please touch base with your physician. Communication with your primary health giver is paramount because it saves you from problems down the road. And if you approach it like that, typically the feedback's been pretty good. You know, and what it does is it reinforces that they're taking autonomy and they're taking control of their life. So they're steering the boat, and they've got a co-pilot. And the co-pilot's a physician or you or me, and we're excited that they're leading. You know, that's an excellent question because you run into it. The most important things come up the last 20 minutes you're with somebody, always. You know, everything's fine, everything, but then the last 20 minutes, all of a sudden a big bombshell. And that's where it's nice if you've got a facility that has good follow-up, you know, or is able to communicate.